Chest infections can be infections caused by viruses, as well as bacteria, and much more uncommonly, sometimes fungi. But these symptoms often overlap and can often start with a sore throat, or sometimes preceded by a runny nose, sneezing, and then a general feeling of tiredness, malaise, lack of energy. And symptoms quickly can go down to the lower airways and be associated with a cough, sometimes with phlegm, and a tightness or even difficulty with breathing. If you have an underlying health condition, that can be even more serious. It can lead to real difficulty in moving around. And I think the way to differentiate that between a simple virus or cough or cold is the duration of symptoms. Simple coughs and colds will often get better within about 7 days. Sometimes cough can persist for 2 or 3 weeks, but generally things are getting better, albeit slowly. And a more significant infection is something that doesn't get better or makes you start to feel really unwell with high temperatures that simply don't get better. And if that occurs, then it's really important to see your GP or to see a hospital-based doctor. Chest infections can make us feel breathless because a part of the lung is not being used in the same way to help oxygenate your body and for gas exchange. It can mean that we can't do the simple things that we take for granted, but maybe going upstairs, sleeping at night, walking with shopping. And in some patients who have an underlying health condition, perhaps generalized weakness or maybe even frailty, a chest infection can make you feel really breathless because of the general weakness it provides. In patients with an underlying lung disorder like asthma, bronchitis, or COPD, a chest infection can make the airways extremely tight, and that can limit the flow of air, and that can make you feel even more breathless. And that's why it's really important to seek medical attention if that happens to you. Many infections of the chest will get better by themselves, including viruses that we all will suffer from time to time. And if that happens to you, then it's important to keep yourself well hydrated, to eat well, to avoid smoking or vaping, avoid any secondary exposures. And most people will feel better within a few days, maybe within 7 days, particularly maybe with some paracetamol if you have a high temperature. If those symptoms get worse or you start coughing up phlegm and the temperatures persist and you start to feel really unwell, it might be that you need antibiotics. And for that, it's really important to see either your GP or another doctor as soon as you can. If you have an underlying health condition or weakened immune system or your medications that affect your immune system, you might need to take medications, including antibiotics, even sooner. And for those reasons, it's even more important to seek medical attention and some advice. Most infections will start to get better within a few days and perhaps within 7 days. But it's not uncommon to have a persistent cough for a few weeks, sometimes even with small amounts of phlegm. The factors that might mean that you don't recover quite as quickly as that could be if the infection is what we call atypical or unusual. That's more common if you've had recent travel abroad to somewhere warm and exotic. That can be a bit more common if you've got a weakened immune system or if you're on certain medications or if you have any underlying lung disorders. And that can mean that the recovery time is much longer. If you're not recovering as you expect, it's really important to get medical attention and get some advice. So chest infections can be prevented by some simple measures that we all can take as part and adopt as part of our routine practices. So that can be simple things like hand hygiene, particularly when we're out in public places, use of a hand sanitizer, sometimes using a face mask if that's something you're comfortable doing. But it's also important to avoid people who you know or suspect to have a respiratory tract infection. Most of us, and particularly if you've got an underlying health condition, will benefit from vaccinations. That's against influenza, against COVID-19, against respiratory syncytial virus if you're within a certain age bracket. And then it's important to avoid smoke and secondary smoking exposure. Sometimes air pollution can make you feel can make your lung health weaker, so it's important to avoid those. Generally, the advice is to keep yourself healthy, to drink well, to eat well, and stay active. And by doing those things, you can help prevent and avoid serious chest infections.